Cardiovascular disease kills over 17 million people every year. Statins alone generate $15 billion annually. And 10 plants have been proven in clinical trials to reduce arterial plaque, lower cholesterol, reduce blood pressure, and protect against the inflammation-driving cardiovascular disease. Some of them match pharmaceutical drugs head-to-head. Today I am showing you all 10. Let's get into it. Plant 1 garlic, the arterial protector garlic, has been prescribed for heart health across ancient Egyptian, Greek, Chinese, and Ayurvedic medicine for 5,000 years. Modern cardiovascular research has confirmed mechanisms explaining every traditional application precisely. Allicin reduces LDL oxidation, preventing the oxidized LDL initiating arterial plaque formation. It inhibits platelet aggregation, reducing clot risk, and relaxes arterial smooth muscle, lowering blood pressure. Multiple meta-analyses confirm garlic supplementation significantly reduces total cholesterol, LDL cholesterol, and blood pressure. Studies show long-term garlic consumption reduces arterial stiffness and improves endothelial function. Crush raw garlic and wait 10 minutes before consuming daily for comprehensive cardiovascular protection. Think of it as the 5,000-year cardiologist treating heart disease through mechanisms modern cardiology spent decades identifying one at a time. Plant 2 Hawthorn, the heart tonic Hawthorn, has been the primary heart tonic in European herbal medicine for over 1,000 years, prescribed specifically for heart failure, angina, and cardiovascular weakness. Medieval physicians trusted it for every condition of the heart. Crataegus monogyna contains oligomeric proanthocyanidins that improve coronary blood flow, reduce peripheral vascular resistance, and strengthen myocardial contraction. Multiple clinical trials confirm Hawthorn extract improves exercise tolerance, reduces symptoms of heart failure, and improves cardiovascular function measurements. Take standardized Hawthorn extract for coronary circulation improvement and cardiac strengthening. Think of it as the heart tonic that medieval physicians used for every cardiac condition, and modern cardiology trials keep confirming was correct. Plant 3 Berberine, the LDL and triglyceride reducer berberine, reduces LDL cholesterol through PCSK9 inhibition, a mechanism so important that pharmaceutical companies have developed billion-dollar injectable drugs targeting it. Berberine inhibits it through an oral plant compound at a fraction of the cost. It also reduces triglycerides, improves HDL cholesterol, reduces blood pressure, and improves endothelial function, addressing the complete cardiovascular risk profile. Multiple clinical trials confirm berberine reduces LDL by 20 to 25%, comparable to low-dose statin therapy, while improving the complete lipid panel in ways statins do not. Take 500 milligrams of berberine 3 times daily for comprehensive lipid management. Think of it as the plant doing what a billion-dollar pharmaceutical injection does, orally, daily, and inexpensively. Plant 4 Pomegranate, the arterial plaque reducer. Punicolagens and pomegranate antioxidants, found nowhere else in nature, reduce LDL oxidation, decrease arterial inflammation, improve endothelial function, and reduce arterial stiffness. A landmark clinical trial in patients with carotid artery stenosis showed daily pomegranate juice consumption reduced arterial plaque thickness and improved antioxidant status, with the placebo group showing plaque progression, while the pomegranate group showed plaque reduction. Drink 8 ounces of pure pomegranate juice daily for the arterial plaque reducing effects confirmed in carotid artery disease patients. Think of it as the fruit that reduced measurable arterial plaque, while the control group's plaque kept growing. Plant 5 Turmeric, the endothelial protector. The endothelium, the inner lining of blood vessels, is where cardiovascular disease begins. Endothelial dysfunction, driven by chronic inflammation and oxidative stress, is the earliest measurable marker of cardiovascular disease risk. Curcumin improves endothelial function, measured as flow-mediated dilation, comparably to aerobic exercise, in a published clinical trial. It reduces the inflammatory markers, driving endothelial damage, and protects LDL from oxidation. A trial showed curcumin supplementation reduced post-bypass surgery cardiovascular events by 65%. Take turmeric with black pepper daily for endothelial protection and cardiovascular inflammatory risk reduction. Think of it as exercise for your arteries, producing measurable endothelial improvements comparable to physical training. Hit that like button and subscribe. Every week we reveal natural cardiovascular solutions with clinical evidence matching pharmaceutical drugs. The next 5 plants include the plaque reverser. Keep going. Plant 6, red yeast rice. The natural statin red yeast rice contains monocolin K, a naturally occurring compound chemically identical to lovastatin, the statin drug. The pharmaceutical compound was derived from red yeast rice. The natural version contains it directly. Chinese traditional medicine has used red yeast rice for cardiovascular health for over 1,000 years. Multiple clinical trials confirm red yeast rice reduces LDL cholesterol as effectively as low to moderate dose statin therapy. Take standardized red yeast rice extract for statin equivalent LDL reduction through the natural form of the compound pharmaceutical companies patented and charged $15 billion annually for. Think of it as the original statin before pharmaceutical companies isolated the compound and built an industry around it. Plant 7, aged garlic extract. The plaque reverser aged garlic extract, garlic aged for 20 months, develops S-allylcysteine and other compounds studied specifically for cardiovascular outcomes. A randomized controlled trial showed aged garlic extract supplementation for 1 year produced a 26% reduction in low attenuation plaque, the soft, dangerous arterial plaque most associated with heart attack risk, measured by coronary CT angiography. The control group showed plaque progression. The aged garlic group showed regression. Take aged garlic extract daily for the coronary plaque reduction demonstrated in cardiac imaging. Think of it as the supplement that reduced dangerous arterial plaque, while the control group's plaque kept growing. Plant 8, olive leaf extract. The ACE inhibitor alternative alurapine in olive leaf extract inhibits angiotensin-converting enzyme ACE, the same mechanism as the ACE inhibitor class of blood pressure medications. A randomized controlled trial directly compared olive leaf extract to captopril, a pharmaceutical ACE inhibitor for blood pressure control in stage 1 hypertension. Both groups showed equivalent blood pressure reductions over 8 weeks with equivalent tolerability. Take standardized olive leaf extract for ACE inhibitor, equivalent blood pressure reduction, confirmed in a head-to-head pharmaceutical comparison trial. Think of it as the olive tree's leaf doing what the pharmaceutical derived from its mechanism does, matched in a published clinical comparison. Plant 9, hibiscus. The blood pressure pharmaceutical match multiple clinical trials have compared hibiscus tea directly to antihypertensive medications with remarkable results. One trial comparing hibiscus to captopril showed equivalent blood pressure reductions. Another comparison to hydrochlorothiazide, a commonly prescribed blood pressure diuretic, showed comparable efficacy. 2 separate pharmaceutical comparison trials showing hibiscus matches 2 different classes of blood pressure medication. Drink 2 to 3 cups of hibiscus tea daily for the blood pressure reduction that pharmaceutical comparison trials confirm rivals first-line antihypertensive treatment. Think of it as the blood pressure tea that has matched 2 different pharmaceutical drug classes in published head-to-head clinical trials. Plant 10, omega-3 from flaxseed walnuts. The systemic protector plant, based omega-3 from flaxseed and walnuts, provides alpha-linolenic acid that reduces systemic inflammation, the driver of endothelial dysfunction, arterial plaque formation, and cardiovascular mortality. Multiple large population studies show populations with highest ALA intake have lowest cardiovascular mortality. Clinical trials confirm ground flaxseed reduces LDL cholesterol, reduces blood pressure, and decreases inflammatory markers. Consume ground flaxseed daily and eat walnuts regularly for the anti-inflammatory cardiovascular protection associated with reduced heart disease mortality across every population examined. Think of it as the daily cardiovascular insurance, reducing the inflammation driving every stage of heart disease from beginning to end. 10 plants: garlic, hawthorn, berberine, pomegranate, turmeric, red yeast rice, aged garlic, olive leaf, hibiscus, omega-3 plants. 10 plants that protect arteries, reduce plaque, lower blood pressure, and reduce the cardiovascular inflammation driving the #1 cause of death worldwide. Confirmed by the same clinical rigor applied to pharmaceutical drugs. Heart disease can be prevented. Nature provided the tools long before pharmaceuticals existed. Smash that like button. Subscribe. See you in the next one.